Hello there. Yes, this is the eye examination room. You're here for a medical exam. Perfect. Please get cozy and just find yourself a seat. That's the chair about right there. We're about a meter or so apart, so just take a seat at the chair that's right in front of me. Good. I know you may have not had me as your eye doctor before, but I am Dr. Retina. Pleasure to meet you. Yeah. And just to double check, could I get your name? Thank you. And how do you spell that? And do you think I could get your birthday? Thank you. Perfect. And on my reports here, on the computer, it says that we're looking at a light examination today. Yeah. Don't worry, it's not uncomfortable. In fact, a lot of people find it to be soothing for a medical exam. And just to begin, are you sensitive to light? Okay. Okay. And have you recently been getting perhaps tired from looking at maybe a cell phone, a laptop, or a computer for long periods of time? Yeah. And do you wear glasses or contacts? Do you know if your eyes, your vision has changed since the last time you've seen an eye doctor? So, just to explain what we're going to do today, I want to make sure you're 100% comfortable. And I'm going to check your eyes, but we're going to focus on light sensitivity. I'm going to have exams with the lights on. And then we're going to turn the lights off. We're going to do something where we follow the light, and if you're able to, identify different colors, okay? Good. So, I'm going to get some gloves on first. How was your day today? And are you someone who spends a lot of time on the phone, or perhaps on a computer, or perhaps a tablet? Okay. Do you get tired often? My glasses have something called a blue light protector. In fact, you can kind of see it when I look at the light. It's meant to stop the blue light from causing my eyes to get tired. So I'll send in a glasses form for you to get one, okay? Good. I'm going to begin with just a very simple look at your eyes. Apologize for getting close, but may I touch your face and your eyes? Thank you. So, look at me. Good. I'm just going to move my finger. If you could follow it now. Good. And follow my finger again. Good. Look up to the left. Good, right there. And I'll look up to the right. Good, right there. follow my finger, I'm going to get close to your eyes. And then back. And I'm going to do that again, close to your eyes. And then back. Do you notice any vertigo? It's when you feel like things are going up and down. Or any double vision, where perhaps you're seeing more than one. Now, I'm going to put a bit of pressure on your eyes, okay? I want you to let me know if that's uncomfortable. I'm going to hold this in 3, 2, 1, and release. And is that uncomfortable at all? Thank you, by the way. Okay. Now I'm going to jump right into the light exam. And you let me know if at any point it becomes painful or it causes you to get a headache or anything of that sort, okay? Thank you. So, I want you to look at the light. Or if you'd like to look at one point, look at the E on that Snellen's chart. Okay? So, I'm just going to shine the light into your eyes. If you could look at the E on the Snellen's chart or look at the light. Good. Once more. Good. Once more. Good. Any double vision, blurry vision. To the other eye, could look at the light, look at the door. So, 3, 2, 1. Good. You okay? Good. And now? Okay. And once more, okay? Any blurry vision, double vision. Now, I'm going to bring this light a bit close to you. What I want you to let me know is, when do you see the light at its brightest? Okay? What that means is, at different directions of the light will be brighter and it will be dimmer. Just let me know when you see that it's at its brightest. Okay? And also, just keep your eye on the light. Good. I'm going to begin with this eye on the left. I'm going to cover this one. Let's begin. Let me know when it's at its brightest. Okay? And once more. Okay? And a little below. Okay? And very good. And above. Okay. And okay. Thank you. So, seems to be working okay. Yeah. I'm gonna test your right eye now, okay? Gonna just cover one eye. Let's begin. Let me know when it's at its brightest. Okay. Okay. Below. Okay. Okay. And above. Okay. Okay. Very good. Now, I'm just going to ask you to follow the light, just with your eyes. And what I want you to do is to try not to move your head or your neck. Don't adjust your body with where the light's going. So I'll give you an example. If I move the light here, don't move your neck. Just follow with your eyes. Okay. Now, following with just your eyes. Are you seeing any double vision, or perhaps something we call replication of light? Okay. Let's try that again, because you said you did. Right in the center of your eyes. Do you see a reflecting light that's somewhere around the light? You do. Where is it? Right here, where is the reflecting light? On top? Okay. And where is it now? Below? Where is it now? To the right? And where is it now? To the left? Okay. That can be caused by double vision and also light reflection on your eyes. It can just be caused by overstimulation from light. Okay, it's normal. So you are seeing double vision when the light is directly at your eyes. So we're going to turn the lights off now, and I'm going to go over the same processes as I've done before, okay? Now, when I turn the lights off, we're first going to begin with another follow the light exam. Okay, let's begin. So, first light is off. Now the second. Just want you to follow the light. Here we go. Good. 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 Up. Right. Down. Left. Up. Right. Down. And then center. Are you still seeing the light reflection, the double vision? Okay, if you do, where is it? Below? Where is it now? Above? And here, to the right? And here, to the left? What does it look like? Like a dot that's going the opposite of the light, like a reflection, okay? Do you see it now? Okay. Do you see it now? Okay. Do you see it now? Okay. And do you see it now? Do you see the double light when I get closer to the center of your eyes? Yes, and you see it now? Okay. And what about here? A little too bright? What about here? Okay. And what about here? Okay. Gonna go from the bottom. Do you see it now? Okay. What about now? Okay. What about now? And what about now? Okay. I'm gonna quickly write that down. So light sensitivity at the center of the eye, even with the lights that are off. And are you feeling any double vision, blurry vision, nausea? Now we're going to do something called a color exam, where I'm going to turn on some lights. I want you to let me know what colors you see. Now to begin, I'm going to ask you, do you have any color deficiency problems with your eyes? I'll give you an example for me. I can't tell the difference much between orange and red and light pink and light purple. Okay, so it's normal. I want to let you know that it is normal and that we're going to begin the exam. Let me turn these lights on. Okay. You can see they kind of give a bright aura. And I'm going to flip through these colors randomly. I just want you to let me know if you're able to identify the color, and if so, just let me know what you see. Okay? We're going to begin with this one. What is this one? Okay. And what is this one? Okay. What is this one? Okay. Let's try this one. Okay. And what do you think about this? Okay. And let's try this one. Okay. And now let's try this one. This one's actually very difficult. In reality, this one is called turquoise. I find it difficult to tell between the green and the blue, but that's what turquoise is. And let's try this one. Okay. And what about this? Okay. And this. And what about this? Okay. Only a couple left here, don't worry. And what about these? And last one. Gonna go right to this one. Okay, very good. Now, gonna turn these off. And now, I'm going to fluctuate with the light of my eye device here. This light that's to the left of me focuses on soft lights, things that are easier to see. So can you identify the color that this is right now? Okay. And what about this? Okay. And the next? Okay. And this? Okay, and what about this? And that? Okay, and this? And that? And this. Okay. And do you see it changing colors now to different settings? Very good. And can you tell me what that is? Okay. So, let's switch it back to where it was. Now I'm going to go in with a magnifying lens light. And I'm going to take a look at your eyes just a bit closer, okay? So, this light is a bit bright. It's more focused on taking a look inside your eyes. Let me get a bit closer, okay? Just going to take a look right into your eye here and just going to check and see what we've got going on. So I'm seeing that your eyes are reacting strongly to the light when it's up close. I'm going to do that to the opposite side now and just going to take a look here and see. What we're looking at is a very strong sensitivity to light, and I think that this might be caused by overusing devices such as computers or cell phones. Okay. I'm gonna turn the lights back on now, okay? That's the first one. And I'm going to keep it a little bit more dimmed light so as to not cause you any troubles with your eyes. Looking at your results here, I do notice that your eyes are fluctuating between overworking when light is directly at your side of vision, your field of vision, and you have a very strong sensation of light when it's in front of you like this, similar to when you're on your phone or using a computer. I'm going to prescribe you some anti-blue light glasses to see if this helps you with your vision. And I promise you at night it will absolutely help you get to sleep faster. Okay? Good. Thank you for being here. Thank you for being so patient with me and allowing me to just check your eyes and examine and check your health, okay? Good. If you have any problems in the future, or if you find that your eyes are the same or getting worse, call us back and we'll schedule you in again, okay? And I'm going to send you your report. What this is going to do, it's going to allow you to just check out what we found yourself. And if you're able to limit screen time, I feel like that would benefit you a lot because it will help you with a lot of things. The less screen time, the better your eyes can fluctuate and focus with the light. The better you are to being outside in the sun as well. The lack of screen time can help you at night fall asleep faster and will help you get a deeper sleep. Okay? Good. Again, thank you for being here. I'm Dr. Retina. If you need any more help or if you get your report and you don't understand anything, call us and we'll help, okay? Okay. Have a good evening. Enjoy your night, and thank you for being here.